everyone, and welcome back to The Journey. Today, as you can see, we're going to be talking about women's health, and particularly, we're going to be talking about the cancer of the uterus, also known as endometrial cancer. Alright, so to start off, I just want to give you some fun facts. Alright, so endometrial cancer is the fourth most common cancer in women. Okay, most women are diagnosed between the ages of 55 and 64 years of age. Alright, obesity increases the risk of the morbidity or mortality with these people who have this disease process, along with 70% of the women who are diagnosed with endometrial cancer still happens to be obese. Okay, and then Caucasian women is 2 times more likely to be able to experience this type of cancer than African American women. Okay, so here are some risk factors that are important to know. So exposure to estrogen. Alright, I'm going to make a video about that, so stay tuned for that. In particular, the hormone therapy, also known as HT. So if you see me write HT, I'm talking about hormonal therapy. Alright, so exposure to estrogen, early monarch, and early monarch is pretty much means you had your period, at least for ladies, you had your period early. Okay, so monarch means your time of menstruation, your period. So an early monarch is pretty much you had it really early. Some people have as young as 8, 9 years old. Alright, some people have as late as 17 years old. So it all depends on the person. Alright. Also, you have late menopause. So women who experiences late menopause, and I'm gonna have a video for that. So stay tuned. Alright. Nulliparity / infertility. So nulliparity, you're probably saying, what is that? What it is pretty much a woman who has never been pregnant, or she's been pregnant but never been able to carry past 20 weeks. Okay. So I put infertility next to that because if you've never been pregnant, you know, it could be signs of maybe you have infertility problems, or, you know, you're not waiting on society and you're saying, you know, I want to get my career established, and you wait and you wait and you wait, right? And you just never been pregnant. So it can always be many different factors, but just want you guys to know it's a woman who's never been pregnant or hasn't been able to carry past 20 weeks, all right? And then infertility, we all know, is that you have the inability to become pregnant, right? For some weird reason, whether it's you're not able to carry because of the uterus is not able to latch on to the embryo, or your body just is not a good host for being able to keep the nutrition going for a vital field. Okay. Also, you have annual ovulation, and what that is pretty much is for women, you know how every month we release an ovary, right? An ovum, which is pretty much an egg, all right? The slang word for ovum. So we're supposed to have one out every month, and it rotates, right? It may come out from the left ovaries, or it may come out from the right ovaries, but you're supposed to have one each month. So what annual ovulation is pretty much, there is no ovum for that month. Sometimes you can skip, sometimes it can be a couple of months without noticing it, right? And then you have those women who have chronic annual ovulation, which could then lead to the fact of why they're infertile. But annual ovulation is just pretty much the ovum did not come out when it was time to come out, right? That month is there, and that ovum is not out in the fallopian tube. Okay. You also have obesity, which we talked about already. 70% of women who have this cancer are obese. All right. Diabetes also plays a part. The use of medication, one in particularly, tamoxifen. Okay, and I've highlighted that in red, or underlined it in red, because that is very, very important. A lot of times I like to ask a lot of questions about a woman is taking tamoxifen, what is she at risk for? Maybe not in that same way, but definitely you're going to see tamoxifen definitely on your test, right? So just want you guys to know tamoxifen is a medication that is used to prevent or treat breast cancer, and what it does, it may cause proliferation of the uterine lining. Okay, so again, this medication can cause uterine cancer. All right, that's the biggest thing that I want you guys to know, is if you don't remember anything else, all right, at least remember tamoxifen, because 9 out of 10 times you're going to see it on your test. All right, and nulliparity is also a big one to remember. Late menopause and early monarch. Most of the time they like to ask those type of questions when it does come to risk factors. Now we have the clinical manifestations, which is also known as your signs and symptoms, which is also known as your nursing assessment. Alright, these are the things that you're going to assess. So you're going to have irregular bleeding, one for a woman who is having her periods and she's having her monthly menstruation, right? normally if they're on the clock where they know every 28 days I have my period, or whatever cycle they're on, they just know it's going to come in the first of the month or the last of the month. Those women who are regular, right, they may be experiencing irregular bleeding, right? It may have spotting here and there. It may be very, very heavy, or it may not. It may come out of that cycle, and it may come, let's say, in the middle of the month. They're known to have it in the beginning or the last of the month, okay? So those are things you want to watch out for. Also, bleeding in menopausal women. So we already know women who go through menopause, right, is a cause of their menstruation. So they should not be having any more menstruation or blood flow at all, because these are the women who are now transitioned over to the later parts of life where there is no more menstruation, right? So those are the two main things that you're going to see as your clinical manifestations with endometrial cancer. All right, so some diagnostic testing that you may do to find out if the patient may be having endometrial cancer, or it can just be something else, right? So we have annual checkups and gynecological examinations. So we already know when you go to the OBGYN or the GYN, right, you do your yearly or biannually, or however often, especially it depends on your age, you will go and do your checkups. And within your checkups, they can be helpful to finding out exactly what's going on with the endometrial lining, the uterus, the cervix, right? All these different things that they're able to see. So you want to make sure that you're still doing your annual checkups, following up with the doctor, making sure that he's monitoring your signs and symptoms and what's going on a day-to-day basis, at least for the year. And, if anything is out of the norm, he may ask you to do other testing, or see, okay, this is not right. You have irregular bleeding. This could be fibroids. This could be endometrial cancer, right? And you want to rule out certain things. So make sure you're going to your annual checkups, right? And you're going to see your GYN. Also, for the menopausal bleeding, right, they may go ahead and do an endometrial aspiration or biopsy, right? And with that, it's pretty much to rule out hyperplasia. And what hyperplasia is pretty much the possible precursor of endometrial cancer. So if they go and they see the hyperplasia, right, it's not saying that you have endometrial cancer, but that's something that can end up leading to endometrial cancer, okay? And then you also have your ultrasonography, and with that, it can also be used to measure the thickness of the uterus, right? Because those women who are in menopausal ages, or in that period, their uterus line is very, very thin. Why is that? Because their body is not producing enough estrogen like how it was before. Because, right, those ovaries and things like that the body would kind of facilitate estrogen and progesterone levels, and all those other, and lactin, and those type of other hormones that will help with the reproductive system, is now closed, right? It is pretty much sold and up for sale, because you're no longer going through that part in your life where you're going to need those organs to function the way it does, because this is your later time in life. All right, so it thins away, but what they will do with this ultrasonography is pretty much check, because if it is becoming thickening, right, if it's thickening up, and it's letting you know that this is a sign for cancer, because those cells like to replicate and reproduce very, very quickly. And when you start seeing those extra thick layers on the lining of the endometrium, that is also a red flag to let you know, hey, something is not going on right, because there's supposed to be a thinning of that layer. Okay, so now we're going to talk about medical management. All right, and with medical management, you can either have a total or radical hysterectomy, which I'm going to have another video letting you know exactly what all the information about hysterectomies. Okay, but to sum it up, it's pretty much the removal of the uterus. Okay, you can have a total, you can have radical, all right, or you can have a bilateral spalpingo-oophorectomy. All right, and you're probably thinking I'm making up words, and I'm not. All right. Spalpingo pretty much means fallopian tubes. So anytime you see this word, you know what they're talking about, the fallopian tubes. And you see oophorectomy, remember rectomy, ectomy, right? Anything ectomy is the removal of, and oopho is pretty much the ovaries, okay? So pretty much when you put that together, it's the removal of the fallopian tubes and the ovaries, all right? And it can be either one side or it can be bilateral, all right? And this one, in this case, we're talking about bilateral, all right? And then also node sampling, right? You have your lymph nodes, right? So you may want to sample it to see if it traveled, if it's metastasized and gone somewhere else, right? So these are all the things that you want to make sure you're being aware of with these patients, okay? Another thing is monitoring the cancer antigen, all right? And each cancer has a marker on them. That's how you're able to know if it's breast cancer, if it's, whatever type of cancer based on the type of cell it is and the characteristic of that cell. So when you're talking about endometrial cancer, right, it's the cancer marker CA, which CA pretty much stands for cancer, 125. So that antigen is 125. So cancer antigen 125, right? When you see those levels increase, right, you want to go ahead and do an extrauterine. That pretty much means that you have extrauterine disease or it metastasized. Okay, so when you see those levels increase, that's what that means. So it's an increase. So what you want to do, you want to make sure that you're monitoring for those cancer markers and seeing is it increasing or is it decreasing, right? And you want it to decrease, not increase, because increase means that it's spreading, right? And it's evolving into something worse. You also have adjuvant radiation for patients of increased risk. So this patient may have adjuvant radiation if they see that the cancer marker cells are elevating. These patients are at higher risk. So those who are at a higher risk, you want to make sure that they have that radiation done. Okay. Also, you have a vaginal brachytherapy. And pretty much, it's still being studied, so there's not really much information about it, at least not in the Brunners and Suddarth book. So that's just another option. You also have the whole pelvis radiotherapy, and this is for the spread beyond the uterus. All right. So your biggest thing is that if the patient does have cancer, you want it to be controlled. You don't want it to spread. All right. So they may do a whole pelvis radiotherapy. Right? So that way, if it did travel above the uterus, that they can at least try to kill off whatever cancer cells that probably have spread throughout the fallopian area or maybe the ovaries, right? So you want to do that whole pelvis area. Also, if you have recurrent lesions within the vagina, okay, you want to have surgery and radiation. And those who have recurrent lesions beyond the vagina, you want to have hormonal therapy or chemotherapy. All right, so these are the things that you want to mention to the patients and things like that, at least information about it. All right. Also, with progesterone therapy is also frequently used, and some of the side effects of progesterone therapy is pretty much nausea, depression, rash, and mild fluid retention. All right, and you already know with every medication there's some type of side effects, whether your body's aware of it or not. You're not aware of it. Okay, so these are just some of the side effects that you're going to see with progesterone. And ultimately, and that's why I put it in the asterisk here, right? The treatment is going to vary patient by patient. Why? Because every patient is different. They may not experience the same things. They may develop different things, right? So ultimately, you want to make the treatment individualized. And why is that? Is because there's going to be a differential in the stages, right? Someone can be in stage 1, stage 2, where someone is in stage 3, stage 4, right? There's a whole nother treatment plan that you're going to deal with, all right? Also, the degree of invasion, how far has it invaded into other areas, right? Depending on how more radiation or surgery procedures that you may have to do because it has spread, right? Also, the node involvement. Did it get to the nodes, right? And the lymph nodes are everywhere. So if it's at a point where it's literally metastasized throughout the body, within the bones, right, you're going to have a totally different treatment plan than someone who had first stage 1, right? So again, as long as you remember that these are some of the treatment options, there's nothing to say that, oh, this is what you're going to do for this patient, this is what you're going to do for this patient, right? It's all going to be individualized, but at least you know what procedures that they can do for a patient who does have endometrial cancer. Okay, so again, that is it. Thank you for watching. If you like this video, please give it a thumbs up. Don't forget to subscribe. If you have any comments, please leave in the comment sections below. Also remember to look at the description box. I'll definitely have a lot more information that I didn't mention on the video. And again, thank you for coming on this journey. God bless.